delivering 18 weeks in cardiology was always going to be one of the most challenging areas for the 18-week pathway because it is a many-headed beast. You have a number of investigations and diagnostics to perform as well as definitive treatments, so it's always going to be difficult. If you can deliver 18 weeks in cardiology, then you can deliver it in anything. The key to delivering 18 weeks is really to understand the pathway, to understand where the weaknesses and the strength in the pathway are, and to work on the weaknesses in the pathway, because often the weaknesses are in fairly circumscribed administrative areas which can be sorted out with relatively little upset to the whole system. Having said which, creative approaches to service redesign, redeploying staff in areas where they can more effectively affect your throughput. Example, for instance, being using heart failure nurses in the form of a heart failure clinic to accept patients is a very good example where a group of healthcare individuals can then be can actually increase the flux of patients through your system. It is extremely important to have communication between everybody in the team, because the team is only as good as the links that it's made up of. One break in the chain and your 18-week pathway will fall to bits. There are many creative solutions. One of the big problems in cardiology is the number of different tests and the fact that there are bottlenecks, particularly in non-invasive imaging, whether with nuclear scanning or echocardiography or stress echocardiography. One way we've approached this is to bring on a CT angiography service, which has given more capacitance in the system and allowed people to move both from angiography and from non-invasive imaging, to look for creative solutions. The real key is trust of everybody involved. And if everybody involved trusts what you're doing, then it is much more likely you will have a successful outcome.